Good morning. Today we are going to learn about one unique condition in ENT, especially in otology, that is the otosclerosis. Till now we have learnt about the infections of the external ear and infections of the middle ear, but this is something different from what you had already learned. So what is this otosclerosis? It's a hereditary localized disease affecting the bone derived from the otic capsule. Here, there will be fixation of the stapes footplate in the oval window because of the deposition of the new immature spongy bones. So, as it is shown here, the bone derived from the otic capsule. Among the ear ossicles, stapes footplate is the one which is derived from the otic capsule. There are synonyms for this otosclerosis. The other term that is commonly interchangeably used is the otospongiosis. So otospongiosis and otosclerosis are the same. So what is the etiology of this otosclerosis? It is commonly seen in second and third decade of life, and it is more common in women, especially during pregnancy. And there are cases where it is aggravated during pregnancy. And there is 50% incidence in the family of a patient who has otosclerosis, and the epidemiological studies have shown that it is more common in whites than the negroes, and it is one of the common cause of hearing in Indians after the chronic suppurative otitis media. So otosclerosis can also be seen as a part of a generalized osseous disease like Van der Hoef syndrome, where it is associated with osteogenesis imperfecta resulting in frequent fractures, otosclerosis, and blue sclera. So, what is the pathology of otosclerosis? Why there is fixation of the stapes footplate in the oval window? In this, the mature lamellar bone of the stapes footplate is removed by the osteoclast and it is replaced by immature spongy bone, and this immature spongy bone has increased thickness, increased vascularity, and cellularity. And grossly, it appears as a chalky white or grayish yellow focus. But sometimes, when the focus is active, it can also be seen as a red spots. So now, what are the types of otosclerosis? As I already mentioned, the most common site that is involved is the stapes footplate, and depending on the site of involvement on the stapes footplate, we have an anterior focus near the anterior crus, posterior focus near the posterior crus of the stapes. It can be circumferential where the otosclerotic focus is seen on the periphery of the stapes footplate. It could be a biscuit type where the entire footplate is replaced by otosclerotic focus, but it is not extending beyond the footplate. Or it may be obliterative where the entire footplate along with extension into the otic capsule, the rest of the otic capsule beyond the oval window, then it is called obliterative otosclerosis. Sometimes the otosclerotic focus can also extend the rest of the cochlea when it is called a cochlear otosclerosis, but in this condition the patient will develop a sensorineural hearing loss. Very rarely or many times the otosclerosis may go unnoticed and it is found only during autopsy when it is called a histological otosclerosis, or either it is seen during autopsy or when a surgery is performed some other disease where the accidentally otosclerosis has been diagnosed. Now, what are the symptoms of otosclerosis? So otosclerosis most common symptom is the hearing loss. Deafness is the most common hearing loss, and the deafness in otosclerosis, it is insidious and it is a painless. Of course, there is no history of earache, there is no history of ear discharge. This you need to remember. Well, the deafness is progressive and mostly it is bilateral, but it can be unilateral also, but generally it is bilateral. So insidious, painless, progressive, and bilateral are the characteristics of otosclerosis. And there is one interesting finding in feature of otosclerosis, the paracusis villisi, where the patient says that they can hear better in a noisy surroundings, especially when they go to a marketplace, they may feel better than during conversation during a less noisy surrounding. So why it is so? The explanation for this is during a noisy surrounding, the normal person will automatically raise their voice. They speak in a louder voice, and the low intensity voices are not heard by the patient. So there will be masking effect of the low, the less noise, and when the other person whom the patient is speaking will automatically increase his loudness. So that may be the cause of this paracusis villisi. And tinnitus and vertigo are the less commonly observed symptoms of otosclerosis. But one interesting feature of otosclerosis is the monotonous and soft speech. They won't speak louder. This can be explained because of the conductive hearing loss, where when the patient is speaking, he hears his speech louder than the external sound. So that is why they tend to speak on a softer volume or a less volume speech. Now, what will be the signs when you examine a patient with otosclerosis? What will be the features on the tympanic membrane? Most of the time, the tympanic membrane will be normal. There won't be any abnormality seen on the tympanic membrane, but less commonly when the tympanic the otosclerotic focus is active, you can see a pinkish or the red hue, that is called flamingo blush, seen on the promontory, and that is seen through the tympanic membrane, and that is called Schwartz sign, and this indicate a active otosclerotic focus. When you do a tuning fork test, it will show either most commonly the conductive, and if there is cochlear otosclerosis, there may be mixed hearing loss. So conductive hearing loss means there will be Renes negative and the Weber's lateralized to the ipsilateral or the worse ear. Now the investigation, two important investigations we require for the diagnosis of otosclerosis is pure tone audiometry and impedance audiometry. Pure tone audiometry alone is not sufficient for the diagnosis. Of course, the pure tone will show a conductive hearing loss in the affected ear, but there will be one interesting finding is a Carhart's notch. What is this Carhart's notch? That is the dip in the curve, bone conduction curve dip at a 2 kilohertz. So this is typical of otosclerosis, and this dip is not shadowed on the air conduction graph. There is no dip in the air conduction, but the dip is seen only in the bone conduction graph. So that is the Carhart's notch typical of otosclerosis. Now, what is the use of impedance audiometry? So impedance audiometry shows a low compliance, decreased compliance of the tympanic membrane. It will be the height of the tympanogram will be lower. So these are the different A type of tympanograms, where type means the normal pressure of the middle ear. So this is the normal A tympanogram, and in otosclerosis we have a shallow or the decreased compliance, that is called AS tympanogram. The increased compliance is seen in ossicular discontinuity, right? So this is the A graph where the pressure of the middle ear is normal. The B and C are seen in C is negative pressure and B is a flat tympanogram. B tympanogram is seen in otitis media with effusion, and C tympanogram is seen in negative middle ear pressure, that is eustachian tube dysfunction. So with the normal middle ear pressure we get a tympanogram, and with the normal middle ear pressure and decreased compliance seen in otosclerosis, that is called AS tympanogram. So these two, if you find a audiometry with the conductive hearing loss with a dip at 2 kilohertz and the tympanogram showing the decreased compliance with the normal mid-layer pressure. So then you are almost certain that the patient has a otosclerosis. But we have some differential diagnosis for this. The differential diagnosis for the conductive deafness with intact tympanic membrane. The differential diagnosis are tympanosclerosis, where there is deposition of hyaline material on the middle fibrous layer of the tympanic membrane and various other parts of the tympanic cavity. Atelectasis because of the persistent negative mid-layer pressure. Ossicular discontinuity, either traumatic or inflammatory, also will lead to intact tympanic membrane but with the conductive hearing loss. Paget disease, that is osteitis deformans and otitis media with effusion. But the differentiation is OME will have a B type of tympanogram. So now what is the treatment? You have the diagnosis and you have to treat the patient. So what is the treatment? Apparently there is no curative medical treatment for otosclerosis, but the tested medicine that is useful in halting the active otosclerotic focus is the sodium fluoride, which is given as a 20 milligram TID and which controls the progress of the disease. But ultimately, the treatment of a mature otosclerosis is always surgery, especially when the patient is young and the hearing loss is only conductive. The surgical treatment for otosclerosis is either stapedectomy or stapedotomy. The difference here is in stapedectomy, the entire foot plate is removed and it is replaced. It is a graft is placed and over that a piston is placed, whereas in stapedotomy a perforation is made on the staped foot plate and the piston is placed between the long process of incus and the perforation that is made on the stapes foot plate. So you are seeing in this animation, this is the otosclerotic focus and stapes is fixed. So whatever the sound vibration is not able to reach the inner ear, whereas after stapedotomy, you are able to see the piston is moving and this is carrying the sound vibration into the inner ear. So that is the advantage of doing a stapedectomy, but it has its own complications like postoperative sensorineural hearing loss. That is why choosing a patient for stapedotomy should be, one should be very careful. I'll be posting one video of this stapedotomy on Newland. Please go through that. And when nothing works, when the patient is not fit for surgery or the patient doesn't want to take a risk of a postoperative sensorineural hearing loss, then the option is always hearing aid. Of course, hearing aid, there are different types of hearing aid now. And if the patient really doesn't want to go for surgery, then we can comfortably advise them the hearing aid. We have the different types of hearing aid like uh, behind the ear, in the ear and in the canal, and there are very tiny hearing aids which can be kept comfortably into the comfortably inside the ear canal. So that's about the otosclerosis, and the please go through the video that is posted in the new learn. Thank you.